One of the things that's so special about this field is that, I mean, yes, it's true, I'm the director of cleft and craniofacial surgery, I'm a surgeon, etc. But really, this is a full court press. I mean, this is not, sort of the typical interface with a surgical subspecialty. I mean, we care for our kids and our families, as I mentioned, actually, even before birth, all the way through adolescence and adulthood. And the reason, and it's not just surgical things, right? So it's not just you're gonna have your first surgery at 3 months of age. Come see us then. We're engaging with these families and these kids on a very regular, near monthly basis in preparation for a lot of the surgical, interventions that are going to be necessary. But ultimately, it's the full team approach and the support of the families that really gets through in terms of the specialness and the uniqueness of this type of care.
It's amazing. I'm thinking how wonderful for families to know about you, because I imagine, at the time when the family discovers that their child's going to have a cleft lip and or palate, it must be so stressful, but then ultimately so reassuring to know that your team is out there.
Yeah, I mean, I like to say that, my job and my team's job is really to do as much of the worrying for our young parents as we can do, right? I think when you and I first met, I even mentioned, we consider ourselves essentially the pediatrician for this craniofacial or cleft difference. And so we take care of all aspects of the care up to and including, if the school needs a note, we'll take care of that. If, the pediatric dentist has a question or the orthodontist has a question, we will take care of that as well. I have a standing offer for all of my families that even, at the time of diagnosis, this can be relatively surprising. It can be scary, obviously. I have a standing offer to all of my families, to set up, telehealth conferences and in-person consultations with extended family. And if grandma or grandpa or older brother or older uncle has a question, I certainly want to be as supportive as possible to my patients and their families. And so I put myself on the front line in terms of answering some of those questions, because ultimately any extended family, any loving environment, extended family and friends will have a lot of questions. And so the care that we provide goes well beyond the examination room or the operating room.
Now, I want to ask you about your mission work that you do. When I was in residency, I met an anesthesiologist who told me that her favorite career moments were when she participated in a group called Operation Smile. She would go abroad for a couple of weeks. She would be the anesthesiologist so that the surgeon could do the cleft lip and palate repair. It really stuck with me that her most meaningful time as an anesthesiologist was doing this work, was helping with cleft lip and palate repairs. And she said, she echoed your sentiments that to fix a child's smile and to give them that confidence that wasn't there before, and to visibly see an improvement in their self-esteem, with one surgery, she said it was such profound, meaningful work. And so I just wanted to ask you about your work, and I'm curious if you've had a similar experience.
No, 100%. I mean, Jessica, I think we're very fortunate, to be in an environment, a healthcare environment, that is generally not lacking in terms of resource. And certainly the needs of any of these patients, either in a resource-rich environment or a resource-scarce environment or austere environment, are the same. And so, one of the real blessings, I think, of the medical mission work is the ability to bring this level of care to folks that otherwise would not have access to it. And it's I help run two missions and go every year, one in Nepal and one in the Philippines. Both missions are essentially led by local partners and the needs that they define in terms of what they want to see in terms of building out their multidisciplinary approach and their ability to support their local communities. And so, rather than going to a location with a full team, only being there for a week and then not having any follow-up, the missions that I'm a part of, more longitudinally based. Specifically in the Philippines, we're working with a local organization that is the longest standing organization in the Philippines, specifically dedicated to cleft lip and palate repair. And so part of our mission there is really just to support the local healthcare system, the local surgeons, and the local providers to provide the same level of care that our kids here in Southern California get. In Nepal, the system that we work with in Nepal is the entire country. They have six, actually now seven satellite clinics out in the Himalayan foothills and across the country. The main hospital that we work with is in Kathmandu, and it has its own residency, its own fellowship, standing faculty, etc. I'm very excited about this particular project because it has the potential to be the first standing mission in the world that can provide comprehensive cleft and craniofacial care. And the reason that is such a point of pride for us is because it's not us sort of swooping in and saying this is what we're going to do, and prescribe sort of the program going forward. This is 100% driven by our local partners on the ground that are identifying the needs in their own communities, and we're rising up to the challenge of meeting those needs.
It's really incredible. I feel like I'm talking to a hero.
Certainly not. It has nothing to do with me. I'm just a small part, a small cog in the machine.
I'm also thinking if you ever need a pediatrician to help you on these missions, please reach out. It sounds so rewarding.
Absolutely. No, no, 100%. I mean, one of the things that I'm really looking forward to as my kids are getting a little bit older is bring them on these missions as well, because there's so much just about, taking ourselves outside of, the comfort zone and cocoon that we live in and seeing, the world with fresh eyes. It really sort of adds to just the human experience and expands horizons in ways that I think, are hard to identify. I've been so blessed to be able to provide this level of care. And it's such a humbling experience, and I grow so much as a person every time.
It's really amazing. I'm so proud of the work that you do. I thank you so much for the work that you do and for explaining all of these interesting aspects of cleft lip and cleft palate and craniofacial repair. And I think it's clear from hearing you talk that you really are humble, and I can tell that you're very passionate about what you do. And again, I'm so lucky to know you, and I'm so glad that you are here in Los Angeles.
Jessica, it was just such a privilege to spend today with you. And if there's anything that I can do, anything that me or my team can do for you or your listeners, we always stand ready to be of service.
Thank you so much. I will definitely put your information in the show notes. And I'm so appreciative that you're here. And last question. You had mentioned that there are some well-known people that have had cleft lip and cleft palates. Are there any names that you can share with the audience just so that they can be impressed by the work that people like you and your team can do?
Sure. Well, it's interesting. One of the most prominent people that I think everybody knows of is Joaquin Phoenix. He's not shy about his challenges and overcoming his journey with cleft lip. But there are sports figures, TV anchor, including Tom Brokaw, politicians such as Mayor Ed Koch from New York, Jesse Jackson Jr., Big Papi from Boston, the Boston Red Sox.
Big
Um,
Papi. My
yeah,
husband's a Red Sox fan. I'll appreciate that one.
yeah, absolutely. Cheech Marin from Cheech and Chong. There are a lot out there. There are a lot out there, and so to that point, one of the things I think that I tell this to all of my parents, that I deal with, and also with the kids as they age. It can feel very lonely when you get a diagnosis like this, but you're not alone. We are here for you. We are here with you. Look at all of these amazing people that have gone on to accomplish amazing things. And that brief list that I just mentioned are just the public facing ones that are vocal about what they've been through. There's, 1 in 600, 1 in 6 to 700. If you sit in a high school gymnasium, you've got somebody in that crowd, at the very least, one or two. And so it's just reinforcing this idea that, the universe might throw you a curveball every once in a while, but you've got people in your corner. You've got people in your corner, and we're here for you.
Thank you so much. Thank you so much for all the work that you do. And I will definitely make note in the show notes of Cedars-Sinai, the Guerin Children's Hospital, and where they can reach you.
Awesome. Thank you so much, Jessica. It was a real privilege.